Life passes by so quickly that in an instant, what was once in control quickly veers out of control. The loss of your job, the death of a loved one, financial strain, aging, depression and anxiety, poor health. All these things can change your life in an instant. When we struggle to cope with these events, we can soon find ourselves trying to anesthetize our pain or just plain check out. You soon find yourself struggling to keep your head above water, and then soon you're submerged, falling overboard into a world of addiction. Nothing makes sense anymore. Addiction is defined as a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's experiences. We know that addiction manifests itself in many forms: alcohol, cocaine, gambling, overeating, cell phone use, gaming systems, all of which can create problems both socially and in some cases legally. How do you navigate addiction, depression, and mental health during a crisis? Stop what you're doing right now and ask if the next 30 minutes could help you or a loved one. If that answer is yes, don't move. Good evening, everyone. I want to welcome you to another edition of Tabernacle Talks. And tonight, we're going to be talking about the person being overboard, whether that be a loved one, whether that be someone that you know. It's just real important that we talk about that topic tonight. Joining us will be Michelle Cox from Women's Recovery Center. And I'm just excited that Michelle has decided to join us tonight. Michelle, if you could begin and talk about the mission of Women's Recovery Center and why you chose to dedicate your life and service to helping people with addiction or recovery issues.
Well, thank you for having me. Women's Recovery Center is a behavioral health program. We're located in Xenia. Our main goal is to empower women to just live to their full potential. We specifically work with women who are struggling with addictions and have behavioral health issues. And I think that personally and professionally, what drew me to working with this population is just the desire to see women continue to grow and continue to get the help that they need in order for them to just live their best life.
Thanks, Michelle. And obviously, if we have gentlemen in our audience tonight, even though Michelle works with Women's Recovery Center, she is an addiction specialist. So please, guys, don't tune away just because you hear that she works at a Women's Recovery Center. In the beginning segment, we saw a lot of things that happen in an individual's life that can derail them, whether it be the loss of a loved one, whether it be their aging and maybe the body doesn't look the way it used to, maybe there are problems on the job. There are a lot of things that can derail a person. Can you give us some terms or what we see in terms of the prevalence of addiction, some of the demographics? What are some of the risk factors for addiction?
So one of the big things that we're seeing now that we didn't used to see before is we're seeing addiction happening earlier in our younger population. When I first started at the center in 2000, the average age of our client was around mid-30s, early 40s. Up until about 5 years ago, we started noticing that about the average age of our client was in their 20s. And these are young women that traditionally would have gone through some type of a, evolution of their drug use, but they're actually coming in, starting on, or have been using IV drugs, which is something you typically see further along in addiction. Another prevalent factor we see quite often is that a lot of these women come from unhealthy relationships that they've been involved with, which is part of what leads them into, either having some issues controlling their use or, co-occurring issues that happen with either anxiety or depression, maybe stemming from that relationship itself.
Well, I have to say that I think this topic is so timely. I know that the world has been talking about the Harry and Meghan interview, and at one point they talked about mental health and the stigmas that are attached with that, whether you're recovering or you have brain health issues. Can you speak to, are people still stigmatized because of brain health or recovery issues?
I believe that there is a lot more people now that understand addiction and behavioral health issues more so than they have in the past. But there still are people that believe that people choose to become addicted or that they should just get over whatever's bothering them. I think a lot of times people don't seek help because they feel like what's happening with them is not that big of a deal. Or it's something they still feel like they can control, or they've never, their family or whatever does not believe that they need the help, so they shy away from getting help for the issue.
So is there a type? I think in common culture, in popular culture, whenever you watch a movie, there's usually the face of what an addict or a person with a brain health issue looks like. But can you describe what addiction looks like now in terms of contemporary terms? Is there a look like at all?
I think there's a lot of misconception about addiction and what addicts look like. I think most people believe addicts are undereducated, they're poor, they're homeless, they've basically lost everything, they've hit bottom. And in all reality, addiction and behavioral health issues can affect anyone, regardless of their economic status, regardless of their family status, regardless of their education. It's not what most people believe it is. It's something that can start as something small, and before you know it, it can become a big issue to the point where you just don't know how to control things and you feel like you're losing control.
Now, I know that you're the director of a recovery center, and I recognize that people come in for inpatient and there can be outpatient treatment. But besides treating the individual, do you feel at times that you have to treat family members and significant others of the person who's actually in treatment?
Oh, definitely. Addiction and behavioral health issues don't just usually impact the individual with them. They're also going to impact the people around them. And as the person is coming through and getting help, it's important for you to involve whoever's important to that person, whoever is significant to that person in their lives, because they're going to be the glue that holds together that person's recovery as they continue down that path. The family members also may need some additional counseling as well, because they may not understand why their family member is behaving the way they are, how to best support their family member. So definitely the family and significant others support systems need to be in place in order for that person to be successful.
I think there's a term that I've heard called codependent. Can you describe what codependency looks like?
So a person that's codependent might think they're supporting the addict or the person with the behavioral health issue, but in all actuality, a lot of times they're enabling those behaviors to continue. And while they feel like they're doing the best they can to support that person, to love that person, honestly, they're actually hindering that person's process by allowing them to continue with the behaviors that they've been doing as part of what their behavior or their mental health issue or their addiction.
Thank you. That's a good point. One of the areas I'd like to speak about is that many times when people are recovering, they may have to actually leave their environment and go into recovery housing. And we know that there has been this national push to deinstitutionalize people and for these individuals to get services in the community. Can you speak about recovery housing and what that looks like and why a person would want to go into a situation where they're completely leaving their home and their friends?
So recovery housing has been around for a while. You'll see that there's a big, it's really become a big thing just recently. There's been a lot of funding poured into recovery housing simply because it's recognized as the next best step for a lot of people who are early in recovery. Once a person goes through treatment and they are learning new coping skills, they're learning new ways of doing things, being in a supportive environment like a recovery house just allows them to continue to further develop those skills, further demonstrate their ability to use these coping skills. And the great part about it is they're in a supportive environment, they're in a sober environment. We can even still continue allowing them to have counseling sessions with their family members just to kind of slowly reintegrate them back into their house so they feel more confident about it when they leave that setting.
Thank you, Michelle. When a person goes into recovery or they've made the decision that I'm sick and tired of being sick and tired and they go into treatment, is that always voluntarily or are there occasions where the person has to go into treatment involuntarily?
So while I would like to think that most people come in voluntarily, a lot of our women have to have some sort of external coercion to kind of convince them that it's a good idea to possibly get some help. You know, a lot of times when you're in the throes of your addiction, you don't see the problem. So unfortunately, it takes family members to give you the incentive to go in. It takes legal professionals. It takes children's services sometimes. It may take your doctor. It may take someone from your church just recognizing that you have a problem and you need to get some help. Now, we do occasionally have people that have come through before that have had a lapse or a relapse, and they recognize that's exactly what it is. They don't want to see it go any further, so they seek out our help as a self-referral to come back in just to kind of work on what that was that happened that they had a relapse over.
Thanks for clarifying that, Michelle. So when a person comes into your facility, because obviously I've toured your facility, I used to be on the board of that facility, so I'm very familiar with the wonderful care that you give families. What happens to their children? If I have 3 children and I now have to go to a court-ordered stay, what happens to them?
So especially at our center, we're a unique center in that we allow women to bring their children under the age of 5 into treatment with them. Our founder a long time ago decided she wanted to reduce every barrier for a woman to be able to get help. And one of those barriers, as you mentioned, is what do I do with my children when I need the help? If the woman is not able to bring their children into treatment with her, then we ensure that they're going to be able to stay safe with a family member. They may stay safe with foster care, but we ensure that they have somewhere safe to stay while the woman comes into treatment. And we do allow them to have visitation with their children while they're in treatment as well, so they can, maintain that connection with their children.
You used an interesting word, lapse versus relapse, and let's talk about the difference between a lapse and a relapse. For example, life continues to happen long after you're recovering, and you may have something in your life that is just so riveting that you may take that drink that you haven't taken in 25 years. Can you describe for the people that are watching what is the difference?
So I know there's different terminology for it in different, support groups and different recovery groups, but if a person has a lapse and they recognize that this is something that that is going to lead me back into addiction if I don't somehow get the help call a sponsor, go to a meeting, get back on track, versus someone who may have possibly had a relapse, didn't see that there was any hope when they first took that drink or when they first used, and decided, I'm just going to go ahead and keep using because I don't see any hope in changing at this point. A lot of people do recognize, like you said, there's a lot of things that, life throws at us. And sometimes the temptation is is more than you can bear, it seems like. But if you're able to get back into your support groups, get back into, help, get the help you need, you can usually cease that and prevent any further lapses or relapses following something like that.
Let's talk about the impact of COVID-19, because I don't think we could talk about mental health or recovery issues without talking about the impact the pandemic has had. We now see this proliferation of telemedicine, and I came up with this term teletherapy. I don't even know if that's a term, but is that effective? If I'm really in a crisis situation and I need help and I'm told dial in on this computer, is that effective for people?
For us, or for a lot of professions, telemedicine and telehealth were a standard. For behavioral health professionals, it became a necessary thing for us to begin doing as COVID-19 came in. One of the things or some of the feedback I hear from some of the people that we use telehealth with or teletherapy is that while it's helpful for them sometimes in crisis situations, they sometimes miss the connection. The personal connection they would get by coming into the office and actually meeting with their therapist. But obviously, we want to make sure everyone's safe and healthy, so we offer that. And sometimes we offer multiple sessions a week, which I think is helpful, too, for people that are used to coming in the office and actually meeting with a person. I know for some people, they get more help when they're physically present. And, I think places have done really good at making exceptions for some of those clients and some of the people that just really need to be seen in person. Because oftentimes, if there's a real crisis situation, just working through it over a teletherapy session is not going to be enough. But I know that there's a lot of places that have made exceptions for specific things if needed.
Thanks, Michelle. If I'm sitting there in the audience and I'm thinking, I probably need to reach out and I need to get help, how do you match the personality of a therapist? How would that individual know that's the right therapist for me? And how would they research that person and what their specialization is?
So if a person is actually looking for help, I always encourage them to ask friends initially if they have friends that have had been to counseling sessions and things like that. A lot of times your friends and family members can recommend therapists that might, match well with you. If not, you can go to the Adamus Board website. The Montgomery County Adamus Board has a list of providers. You could go through there and look. You can go to different search engines and type in specifically what kinds of things you feel like you need to work on, and it will help you find therapists that specialize in those specific things in this area. But yeah, I think that referrals from family, friends, people that you trust is usually the best place to start.
Thanks, Michelle. I think that's extremely helpful. Let's talk about the trauma that coexists many times with addiction and mental health issues, because it's not just stopping the use of the substance and it's not just medicating to be able to restore brain health in those situations where that's appropriate. There sometimes is a trauma component to this, and talk to us about how trauma impacts addiction.
So trauma has been linked to addiction for quite a long time. If you think about it, we had soldiers coming back from wars that were struggling with what people didn't know at the time was post-traumatic stress disorder. And there was, people were wondering how come they were coming back from these battlefields and they were addicted to things. Addiction, especially with women who've had traumatic experiences, they are more likely to abuse substances to help deal with the feelings surrounding that specific event. A lot of times it's not so much the event and thinking about the event, it's actually the feelings that they currently do not know how to deal with that relate to the event that may have happened years ago. Or it may be a situation where they're in some type of a relationship where they're continually being traumatized, and the only way they know how to deal with it is to use. Trauma is one of those things that you have to effectively help the person with, in addition to their addiction and any other mental health issues they have. You have to do all that together. I know there's a theory that if you do, you have to treat the addiction first before you can treat the mental health. But in all reality, you have to kind of treat it all together in order for that person to move into recovery. You have to realize they're recovering from a lot of things. So the best thing to do is just treat all that together and make it be their recovery plan, not only from addiction, but also possibly from their traumatic and, their feelings around their trauma and any feelings they have, any mental health symptoms they may have.
Yeah, I want to turn our discussion to, in some communities you drive and there's a drive-through on every corner. They now have it where the restaurants, you can take alcohol home. And we are now starting to see that any type of society where you prohibit something, it seems like people want it more. So you're now starting to see that, I believe it's like 16 states, we've actually legalized marijuana, and you see the CBD oils and all these things that are kind of like triggers. How do you navigate a substance abuse issue when you now see that 16 states have said it's really okay to smoke marijuana and get high?
Right, that's the question that a lot of people have. My belief is that with addiction, if you have a predisposition for addiction, oftentimes your brain, the addicted brain, is not going to recognize what's legal and what's not legal. So if you introduce some type of substance into your system, your brain, if it's addicted, is not going to know the difference. Another example would be people that are addicted to shopping, or people that are addicted to shoes. I have shoes, so that's why, yeah. But my point being is that if you have that predisposition, your brain does not know the difference between one thing or another. You have to determine for yourself if this is going to present a problem for you. If you just, if you're looking into this. I always encourage people that ask me about this in treatment to talk to their therapist about it, talk to their doctor about it. If it's a specific condition that you're wanting, you're thinking it might help, make sure you talk to your doctor about that and be honest with them about your history with addiction, or if you're in recovery, so that all of you together can make the best decision for you.
I think you bring up a really good question. I want to ask about loved ones. Obviously, many of us know of a loved one or someone who we perceive has a problem. What is the best way to confront them as an individual in a loving way so that it doesn't come across as judgmental, but that you get the point across that they need to get help?
I think that that's one of those positions that family members get put in quite often. I get a lot of phone calls from family members, just with exactly what you're saying. How do I talk to my loved one about the fact that they have a problem? And I always tell them initially first, if they need to educate themselves about the problem, whether it be reaching out to Al-Anon meetings or Nar-Anon meetings or family of addicts meetings, just to kind of get a better understanding as a family member, how do you address these things? And then also too, I talk to them about seek your own help, seek your own counseling. but also be direct with that person. Let them know that because I care about you, you need to get some help. And if you don't feel like you can do that and you still know they need some help, there are places out there that can help you kind of intervene with that person and help you talk to your family member about the best way to get help for them.
What do you tell clients typically that come to the Women's Recovery Center that makes them believe that recovery, it happens, that there are people that are successful and that they can be successful? Because I'm sure when they first walk in the doors, they don't believe. They're probably at such a place, they just don't believe that there's another side. What would you tell them about the other side?
Well, I think we have one of our great benefits is that we have an extensive alumni program, and we actually have some of our alum that work at the center. So they're living proof that recovery is possible and that you can be in recovery for a number of years and still be living a great life. For some people, though, it's hard for them to see beyond today, this minute. A lot of times with folks, we just tell them, you have to stay sober for right now. You have to stay sober for this minute. You have to stay sober for this day. And each day that you're sober will lead to another day, will lead to another day. And after a while, you're going to see those benefits in your life from staying sober. But for today, you just need to focus on, I'm not going to pick up or I'm not going to use today.
Well, Michelle, you've given us some really important information, and I'm hoping if someone in the audience needs this information that you take this serious. Maybe this is the time for you to go in your room and really just have a talk with yourself about where you are. Or if you have a loved one and you need to have this conversation with them, it's never too late to do that. Michelle, I'm going to give you the last word. If you had to look into that audience and there's someone that's watching and they maybe want to dial that phone because they know they need help, what would you tell them?
This is a big decision. If you need help, I would encourage you to reach out as soon as possible to get that help. There's a lot of people that hesitate and they don't feel like they need it. They don't feel like they're worth it. They don't feel like it would do any good for them to ask for help. In order for your life to get better, you're gonna have to ask for help. You didn't become addicted. You didn't get into this situation all by yourself, and it's gonna take more than just you to get you out of this. I would encourage you to reach out to who you can to get the help, but if you have any questions or maybe you feel like we can help you, you're more than welcome to call Women's Recovery Center at 937-562-2400, and if we can't help you, we can point you in the direction of someone that can.
Thank you, Michelle. We're going to leave you with some closing thoughts on our recap. Let's recap. Excessive alcohol use can increase a person's risk of stroke, liver cirrhosis, alcoholic hepatitis, cancer, and other serious health conditions. 2 out of 3 drug overdose deaths in 2018 involved an opioid. About 80% of people who use heroin first misused prescription opioids. Elderly women are more likely to fall victim to grief gambling after the loss of a spouse. 50% of individuals with eating disorders struggle with substance use disorders, and up to 35% of those individuals also have eating disorders. According to the National Safety Council, cell phone use while driving accounts for 1.6 million crashes each year. The World Health Organization has classified gaming disorder as a disease in the International Classification of Diseases. you.